This is a demonstration of a very common arch taping technique called the Lodi strap. Tape applied to the skin is a very effective way to help support the foot. And when we talk about supporting the foot, we're really talking about controlling abnormal foot pronation. Tape in conjunction with the use of an orthotic as well as a shoe oftentimes is an extremely good way to help treat various lower extremity conditions. What we do when we use tape is we try to use tapes with very strong adhesive properties and tapes that have some ability to stretch. One of the premium tapes on the market is a kinesio tape. K-tape or kinesio tape has many different purposes in sports medicine, but it's a very good tape for the common person to use in terms of taping their own foot or having someone else tape their foot for their various lower extremity condition. Be careful when you're using tape. Tape certainly against the skin can create blisters. So you have to be very thoughtful about any discomfort that you're experiencing. If you're feeling pinching or pulling, please certainly make sure you take the tape off. Also be very cautious about the adhesive. Some people have sensitivities to adhesive and can develop rashes as it relates to the use of any tape product. The K-tape stretches about 140% of its normal length. So as this is the standard length, what we see with the K-tape that it does stretch very significantly. This is a high quality adhesive and it comes with a backing, as you see demonstrated here, to improve a little bit its ease of use. What we do when we're doing the Lodi strap is we first aim and align the shin bone to the second toe. We don't want to have the foot turned in or supinated or turned out or pronated. So whether you're having someone tape you or you're able to tape yourself, remember that second toe in line with is what we would consider a subtalar joint neutral position. What we'll use initially is the 5th metatarsal head or metatarsal bone as a landmark. And this 2-inch adhesive kinesio tape is applied just behind the metatarsal. And what we're doing is essentially aligning what we call the lateral column of the foot. So as that foot is held in that foot neutral position, we're adhering the tape, trying to keep all the wrinkles out of the tape, which is fairly easy for kinesio tape. And we're really stretching with tension. And it's really important to get tension on kinesio tape for it to be as effective as possible. Any remnant or excess we'll go ahead and trim off. So after the initial arch strap that we're putting on from the 5th metatarsal extending to just behind the 1st metatarsal, we're now essentially creating additional straps across the arch itself, which really gives the taping procedure its support. We start from the very outside portion of the foot or lateral column and pull under tension with that foot in neutral position into the arch. Okay, we're trying to be careful of skin wrinkles, and we're trying to certainly avoid any wrinkles in the tape itself. So we'll usually do 3 to 4 tapes across or straps across, and we're splitting them up about half the distance of the tape. So the last portion of the tape, what we do is really extend the foot at the ankle significantly, and we put the last strap on, and this kind of locks the tape in, and you can definitely put it on a little tension. You have to be a little bit careful on the top of the ankle so as you don't irritate the skin on top. So you can see, you know, there are a few wrinkles in this tape. The main thing is we actually have tape nicely adhered to the skin itself, and we're not seeing wrinkles or bunching of the skin. The great thing about K-tape is that, you know, it's really moisture resistant. So, you know, the normal moisture of the skin is not going to cause that tape to come off. A traditional cloth-based tape really has difficulty in terms of staying on the skin. So this is a tape that will sometimes leave on for 3 to 5 days at a time. Certainly it works better if you can keep it dry, but it can get wet. But this also can be used before and after specific activities. The K-tape itself and this arch taping technique do a great job for treating plantar fasciitis, and that when a person stands, this controls pronation and it decreases the tension stress and the tension load on the plantar fascia. But it is certainly used very commonly for people who have midfoot pain. The skeletal example shows the midfoot joints. And when we're really using, for example, a shoe and an orthotic in conjunction with the tape and or just the low dye tape alone, what we'll see is that there's going to be decreased load through this midfoot. So people who even have midfoot pain will oftentimes show significant improvement with the use of this tape as a treatment tool.